My name is Mark Rosenberg, and I'd like to begin by thanking the board for taking the time to listen to my presentation. Until about 9 years ago, I was a full-time emergency physician. I'm board certified in emergency medicine. Approximately 9 years ago, I had the unfortunate duty of evaluating my mother who had chest pain, and I diagnosed her with metastatic lung cancer to her liver, spleen, both her adrenal glands, and her left hip. I then took her to the institutions where I trained, and both institutions told me the same thing. We can do chemotherapy, and maybe she would live 6 months. No chemotherapy, maybe she'd live 4 months. We elected not to do chemotherapy. My mother lived for 11 months, and that's when my journey began. Since diagnosing my mother with advanced stage cancer, my career abruptly changed course. I'm no longer doing emergency medicine. I'm now an integrative oncologist and a cancer scientist. In addition, I'm the program director for the first and only existing integrative cancer fellowship. If you know the statistics, I believe you will help me to help others. In 2004, there was a very important meta-analysis that was published in the British Journal of Clinical Oncology. And that study looked at every randomized clinical trial in both the US and Australia that claimed that chemotherapy extended 5-year survival. What they found is it did extend 5-year survival in 2.1% of the studies in the United States and in 2.3% in Australia. Generally, when it did extend survival, such as in lung, in breast, in GI cancers, it amounted to about 60 days, 2 months. If you think a 2% improvement in survival or 60-day improvement in survival is acceptable, then don't support my efforts. But certainly, my colleagues and I believe that's not acceptable. There are many different techniques that I use, but one of the main reasons why we've made no headway on advanced stage cancer is because when we use large doses or maximum tolerated dose chemotherapy, we don't kill the cancer stem cells, but we actually make the cancer stem cells more resistant. So what I'm actually saying is our treatment makes a cancer that's even more aggressive than it was before we started treatment. We're actually accelerating the growth of the cancer, and it can cause the patients to die earlier than they should. One of the techniques that we use is low-dose chemotherapy. In addition to that, I developed a technique to attempt to target the resistant cells and the stem cells. And what are my results? My results are exciting. They're exciting, and you'll see one of my patients who was diagnosed with stage 4 and is now in complete remission. They're exciting because we see now that cancer can be treated as a chronic disease if it can't be cured. But we must deviate from the standard of care because the standard of care is not working.
Welcome back. According to the American Cancer Society, close to 12 million people in the U.S. are living with cancer. Some are dealing with late-stage disease and usually a terminal diagnosis. But now, one South Florida doctor is working on a whole new alternative cancer treatment that may offer hope to those with aggressive forms of the disease. Mary Nesbitt considers herself a smart woman, but she admits that for years she ignored the warning signs of endometrial cancer.
Kept thinking it'll go away, I'm too busy, I can't be bothered with this.
But her symptoms got worse. By the time she was diagnosed, the cancer had metastasized. Mary's oncologist said she needed aggressive chemotherapy.
I said, if I don't, what am I looking at? He said, you've got a good year.
A friend of Mary's suggested she seek out Dr. Mark Rosenberg, who's been working on a way to kill cancer cells without chemotherapy.
What I started doing is looking at what is the commonality between cancer stem cells versus the non-stem cells.
Rosenberg found that most cancers feed on glucose and process it through a mechanism called glycolysis. The end product of glycolysis is lactic acid, which cancer cells need to get rid of in order to survive.
My thought was, if I could impede or interfere with the ability of the cancer cells to pump out lactic acid, both the stem cells and the non-stem cells, the more they feed, The more lactic acid they make, the faster they kill themselves.
Help me help other individuals. Help me help patients. Your dollars go directly to patients who can't afford this treatment. And why can't they afford this treatment? Because if it's not standard of care, it's typically not reimbursed by insurance. So please help me change the face of advanced stage cancer, because cancer is now affecting not only the elderly, but it's affecting the middle-aged and the young adults and the children more than ever. I appreciate your help. Thank you.